As we talk about various joints in the body, we're going to talk about shoulder pain. Shoulder pain is a very common condition in sporting activities when we get injured. The shoulder joint is more like a golf ball on a tee compared to a hip joint or a knee joint, which is very stable. The shoulder has two main potential injuries, the labrum and the rotator cuff. The labrum provides stability or restraint within the shoulder, and the rotator cuff provides strength. It's like the motor in the shoulder. These injuries can occur in throwing sports, such as baseball, tennis, weight training, football, which is a contact sport where the shoulder can get injured in a very violent act. Going to the doctor for shoulder pain should occur when the pain stays longer than 3 or 4 or 5 weeks and you've rested it and you've iced it. Going to the doctor is important to treat it so that you can avoid the injury getting worse, such as muscle atrophy, which occurs with a rotator cuff tear. When you go to the doctor, you can expect to be seen, have your shoulder examined, and diagnostic studies would be done. These diagnostic studies will include an X-ray or an ultrasound in the office. The doctor may want to order an MRI. These studies will help to determine if there is a labral tear, if there's a rotator cuff tear. If you have a labral tear, surgery may be required. The same for the rotator cuff. If it's torn, it may require surgery. However, in most cases, there tends to be a straining injury which occurs and not a complete tear. That can be generally treated without surgery. That would include treatments such as physical therapy and acupuncture. Medications could be used such as anti-inflammatories like Advil or Aleve. Ice will be utilized, and then activity modification will be utilized to help allow the muscle or tendon or labrum to heal. The treatment, if it is torn, is arthroscopic surgery. It's an outpatient surgery. It can be done in an outpatient setting with a light general anesthetic. Recovery is generally quick. It will require physical therapy. If it's a labral tear, therapy would begin at 3 or 4 weeks after surgery. If it's a rotator cuff tear, that will begin with physical therapy about 3 or 4 weeks after surgery also. Other treatments that can be done besides surgery when things are torn include PRP. That is a treatment which involves plasma-rich platelets, where we draw blood from our arm, we spin it down and use these platelets to get the tissue to heal. That's been used more commonly now. Insurance carriers don't necessarily always pay for this, so that might be an out-of-pocket cost. In summary, the shoulder injuries do occur at all ages. They can occur with contact sports such as football. They can occur in throwing sports such as baseball and tennis, which is like a throwing sport. They also can occur with weight training and weightlifting, especially overhead weight training. If you develop pain, generally rest, ice, and activity modification should be done immediately. If it doesn't improve after 3 or 4 weeks, going to the doctor is very important to treat it.